Ladies and gents, welcome back. Sometimes it takes a little while for the news to get to the maritime provinces, even in the offices of the CBC. Here we have Higgs being the premier of New Brunswick. We'll all get COVID comment strikes a nerve. Immunocompromised Fredericton woman hoped for more compassion from the premier. Hoping for compassion, not just the facts, folks. Premier Blaine Higgs has talked about living with COVID for months now, but he's never articulated what that concept means quite the way he did last Friday in the legislature. Higgs literally shrugged as he predicted in a scrum with reporters that everyone in New Brunswick will probably be infected by the virus eventually. My jaw dropped to the floor, said Fredericton resident Jessica Bleasdale. I had never really quite heard him articulate it in that manner, that it's just an expectation that we all get COVID. That's an unacceptable response during a pandemic. Well, what did he actually have to say? This is where it gets interesting.
Recommendations that we received from public health were very, very clear. When they put the stages of winter operation and opening, it was clear. And the goal was to ensure that hospitals could manage, because we know that probably at the end of the day, we'll all get COVID in some manner or another, and maybe it won't be what we think is COVID. We'll think it's a cold, but we don't know. But they've said we know we have to find ways to live with this, and we know that we have to be sure that our hospitals can manage it. And what we're seeing and continue to see is our hospitals can manage this, and we have done so throughout the entire pandemic. We never had to go outside the province for additional hospital care.
That didn't sound quite the hyperbole that we just listened to a moment ago. University of Toronto infectious disease epidemiologist Dr. Colin Furinas says the premier's statements represent an abandonment of the people most at risk from severe COVID symptoms. I think the comments appalling. And I think it's a huge violation of the social contract. Is it now? Now, is this something that we're not hearing from other places? Is this only in New Brunswick or the premier is saying things like this? Let's look at our friends over in Australia. How are they responding to this?
Bottom line here is that we would expect that pretty well everybody in New South Wales at some point will get Omicron. We're all going to get Omicron. And if we're all going to get Omicron, the best way to face it is when we have full vaccination, including our booster. The challenge for us in the state is to make sure that our health system can cope with that oncoming virus that is so transmissible. It's extremely transmissible. And generally, what we're finding, though, in the early stages, and both international evidence and the state evidence here and the Australian evidence, is that Omicron is not as severe in terms of its impact on individuals. That is a huge plus for all of us.
All right. So that's okay. Now it's not sounding so bad. Oh, here's Fauci talking about it.
We're not going to eradicate this. We've only done that with smallpox. We're not going to eliminate that. That only happens with massive vaccination programs like we did with measles and with vaccines. But we ultimately will control it. And if you control it in a way it's at such a low level and people are vaccinated and boosted, sooner or later, as we begin to live with it, what she was referring to is that virtually everybody is going to wind up getting exposed and likely get infected. But if you're vaccinated and if you're boosted, the chances of you getting sick are very, very low.
So everyone is going to get it. It sounds like there's a theme going on here. I wonder if anyone else has ever said anything like this.
Pandemic. Where would you assess where we are today in beating COVID-19?
Well, sadly, the virus itself, particularly the variant called Omicron, is a type of vaccine. That is, it creates both B-cell and T-cell immunity, and it's done a better job of getting out to the world population than we have with vaccines. If you do sero surveys in African countries, you get well over 80% of people have been exposed either to the vaccine or to various variants. And so, what that does is it means the chance of severe disease, which is mainly associated with being elderly and having obesity or diabetes, those risks are now dramatically reduced because of that infection exposure.
Okay, so we're getting news from around the world that everyone is gonna get it. I think that is precisely what Higgs was saying here. But that doesn't stop the shock. That doesn't stop the shock. I think the comments are appalling. I think this is a huge violation of the social contract being said here by an epidemiologist, Colin Furness. Interesting. Beesdale has complained to the College of Physicians and Surgeons and to the New Brunswick Human Rights Commission about the Chief Medical Officer of Health, Dr. Jennifer Russell, commenting on the end of mask mandates in school. So this woman obviously not wearing a mask in this photograph, is very, very worried. Jessica Bleasdale says in her jaw dropped to the floor when she heard the Premier's comments. Bleasdale is pushing to have mask mandates reinstated in public schools. Fear the virus that the rest of the world is honestly waking up to. My first response was anger, says Elizabeth Doherty, a Fredericton University student who is immunocompromised and who suffered severe COVID symptoms since testing positive March 11th. I don't feel he's addressing the people most vulnerable to the virus when he says those statements. I feel like we're once again left out of that. Now, he's clearly referring to the citizenry, like writ large, like everyone in New Brunswick and the world moving on from this pandemic. Now, I understand that people are immune compromised, and those people should take very special care in this situation, as they should for any other type of ailment that could be received via catching it from somebody else. You should be very careful for all of those things. There are a number of things that go around. Speak of the norovirus. Norovirus is very common and can definitely hit people who are immune compromised extremely horribly in the winter season. But as for the rest of us moving on, I think that is definitely something that we're all going to come to grips with at some point or another. But that's all I got for you this morning. We'll see you in the next video. Keep on trucking.